something happened here. It's now or never. 'Cause something happened here.
Welcome back to Artemis Radio. We are at episode 13, and we have a very special guest with us today, Sang Choi. She is the dispensary director at Etain, the only women-owned dispensary in New York. Yes. And today we are talking about a topic that I'm extremely passionate about. It's cannabinoid pharmacology. The reason is that I would love to know, and for Sang to share, what cannabinoids can actually do with our bodies and for our bodies. What, in your opinion, is the biggest difference between a plant-based therapy versus a traditional drug therapy?
Sure. So we're talking about CBD from hemp. We're talking about other cannabinoids from a marijuana plant. So what it does is it affects different systems in our body. It's called the endocannabinoid system. So it affects our central nervous system. It affects our immune system, our gastrointestinal system.
It's on your skin too.
It's on our skin. It's in our muscles. So it is. It basically affects all those systems. Now, pharmaceuticals are pretty targeted. So let's say you have high blood pressure, then you would take a medication that will lower your blood pressure. And if you have high cholesterol, you would use a medication that would decrease your cholesterol.
Right. Because of what you shared, it feels like CBD is a magic bullet. It's a cure-all. It helps with our pain. It helps with our stress levels. It affects our skin. But due to the fact that it affects the endocannabinoid system, with that is spread out throughout our whole bodies, those ailments can be reduced using CBD.
Sure.
Yeah. So one of the things that happens at the store a lot is the topic of dosing, meaning that a lot of people come in and they ask if they take CBD today, can they feel something right now? What is the difference between dosing on CBD versus dosing on traditional drug therapies?
I mean, so there are a lot of medications that work like CBD in the sense that you do have to take it for a period of time for it to really have an effect on your body. So I would say it could take between 2 to 4 weeks to really find the right dose and figure out sort of if you're having any effect from it. Then you have to kind of go up or down in the dose to try to figure out if it's actually working for you. Right. So there's pharmaceutical drugs that do the same thing. So if you would talk about like antidepressants such as SSRIs, like Prozac, like Lexapro, it does take a good 2 weeks to really feel any relief from that as well. So there are lots of medications that work in a way that you do have to build it up to a certain level in the body to really work.
And would you say that microdosing is one of the best practices that you can to figure out what your optimal dose is?
Yeah, 100%.
Right. So at the store, we always tend to dose, at least at the microdosing level, at 5 milligrams to see how your body feels. And I think 5 milligrams for most people is just subtherapeutic. They shouldn't feel much at all until they actually reach their optimal levels by increasing it slowly. With that mechanism, is that similar to an SSRI or an antidepressant?
Yeah, I mean, of course, there are standard doses that you start with in pharmaceutical medications because studies have been done that show that this milligram or this strength will work a certain way. So now you start with the dose, but you go either up or down just depending on, let's say, the effects that you're getting, the side effects that you might be experiencing. So CBD is also very similar to that in the sense that we do start with a small dose. We start with maybe 5 milligrams. On a daily basis, spread out throughout the day. You do that for a week or so, and then maybe you increase the dose in 5 milligram increments. So you just kind of titrate until you have the effect that you're looking for. And again, it might not work right away. It might really take some dedication on the patient's part or the person's part to really see if it works or not.
Right. An analogy that we actually have at the shop is that I was on Lexapro for almost a year. And I remember being on Lexapro. They gave me 5 milligrams first, and then in a month later, they checked up on me. They go, hey, how is 5 milligrams working for you? This is like psychiatrist asking, right? And then I go, I didn't really do much. Then they increased it to 10 milligrams and see how I felt. Then a month later, they checked up on me, and I was like, I think 10 is doing good. And they basically stayed at 10 milligrams. But with CBD, you don't have a person calling to check up on you. You are your own basically meter to see what is your optimal dose. It's much more interactive than the traditional drug therapy route.
Definitely. I think there's kind of a beauty in that, in my opinion, where it is a customizable dose that works for you because we're all so different. So maybe 5 milligrams might work for me. I just don't know. Maybe it'll work for you. Maybe I need 50 milligrams. I'm just not sure. So it's one of those things where you can really fine tune it and figure out the dose that really helps you.
Right. So let's actually get into the deep level of that. CBD and THC, let's say a full spectrum tincture or a full spectrum oil. Where does that affect, at what receptor site would that affect our bodies?
Sure. So mostly CB1 and CB2 receptors. CB1 receptor is primarily located in our central nervous system, so in our brain. And then you have CB2, which is kind of scattered throughout our bodies, in our organs, our pancreas, things like that. So THC has a high affinity for CB1. So that's why you feel the psychoactivity, because it kind of sits right in the receptors in the brain. So that's why you feel a little bit off or, relaxed or, a little happy. Yeah. And then you have CBD, which doesn't directly bind to receptors, but actually inhibits an enzyme that breaks down our body's own endocannabinoids. Yeah. So we make something called anandamide and 2-AG. So those anandamide is called the bliss hormone,
right?
And it kind of works just like THC. So it keeps it in our bodies a little bit longer to have the THC effects.
And how does CBD affect or interact with our serotonin and our GABA receptors?
Yeah, so it does have some affinity for our serotonin receptors, and CBDA especially has a high affinity for our serotonin receptors. So by using that receptor, by manipulating that, we can actually affect mood, decrease anxiety. Serotonin receptors actually play a big role in nausea as well. So by using CBD or CBDA, we can help to decrease some of the nausea too for, let's say, patients going through chemotherapy.
Oh, interesting. Yeah. With CBD helping just to reduce inflammation,
sure,
at what part of the body would that interact with?
So it works in our immune system. So our immune system regulates inflammation. So if you affect the system with CBD, it'll bring down the inflammation, not just in our muscles, not just in, painful situations, but, all over our bodies, in our cells, per se.
And then I think now the topic is, how do I get to the right dosing that will help me alleviate whatever ailments I'm trying to target?
So again, it's trial and error.
Right.
You start at a certain place, you start at a certain dose, and, we can play with the dosing a little bit, but whatever you do, you have to just give it, some time for it to work. At least 2 weeks.
At least 2 weeks.
At least 2.
Every day.
Every day, at least for the first 2 weeks.
So can someone who wants to use it just as a spot treatment rely on CBD to do that?
CBDs probably wouldn't be very effective in that way. It is one of those things that does build up in our system to have an effect. So that should be used once you get to a certain point that you're getting the effects that you want. It's relieving some of the conditions that you're taking CBDs for. Then I would say you can do every other day, but it's not going to work as needed.
So the topic is now, will I be dependent on it?
No, it is not addictive.
Yeah, I was reading that the World Health Organization actually declassified the addiction and dependency on CBD for that particular reason. Right. There is Epidiolex now. This is the first plant-based CBD drug that has been approved by the FDA. With Epidiolex, do you find that in the future there's going to be a lot more of these discoveries and drug that is involved with CBD or THC?
Yeah, I think we've just hit the tip of the iceberg, in my opinion. This plant it's an amazing plant with so much potential and so many compounds that we just really don't know about. We just really know a lot about THC and CBD because they're most abundantly available in the plant, but there's so many other cannabinoids that can do so much.
Right.
So I think just depending on how the federal government decides to shift, there's going to be a lot more studies being done, and I think that's really important.
Yeah. I know I'm really excited for CBDA. I think one of the things that when I was researching CBDA is shows up up to 5 times more potent in our bloodstream than CBD. So you actually have to take less of it.
Yeah.
So for me, I battle with IBS. I battle with pelvic spasming, and I've been taking a tincture that's a 1-to-1 with CBD and with CBDA, and it's greatly has helped just reducing the symptoms of
great.
both. So just like taking plant-based therapies or drug-based therapies, let's talk about the side effects, right? With cannabinoid therapies, should we watch out for any drug interactions?
Sure. So it does metabolize through our liver, a system called the cytochrome P450 system. And a lot of pharmaceutical or traditional drugs actually go through the same metabolism process as well. So you want to watch out for certain drug interactions like warfarin, which is a blood thinner, alcohol. Sometimes, we're talking about THC, but THC can actually enhance or work synergistically with THC and alcohol. So sometimes you might require less of both to feel the same effects that you did maybe if you had THC alone or CBD alone or with alcohol alone. Yeah.
But can we get this question out of the shop too? So if I really like my glass of wine at dinner, is that okay for me to take CBD after that? Or
Sure.
Yeah, so it's just not together.
Yeah, it's not contraindicated.
Okay.
It's not like you can't use it together, but you might feel a little different.
Okay.
Yeah.
Okay. Yeah. Just side note, just make sure that you space out
Yes.
the intake of both.
Definitely.
But so the cytochrome P450 enzyme, watercress also affects that too.
I had no idea.
Yeah, right. I know the grapefruit does, because I know that there's a lot of medications like do not take grapefruit with it. So that was one. But I didn't realize watercress was a part of that family as well.
Right. Because it can actually, grapefruit juice can actually inhibit the enzyme, which increases certain levels of drug in the body, which can be toxic.
I see. So with this episode, we cover just cannabinoid pharmacology. This particular plant-based therapy affects the endocannabinoid system, which covers multiple parts of our body. So a lot of times it sounds like a magic bullet, mainly because it does affect our mood. It affects our inflammation level, our pain threshold, and also can help with our skin too, because it can actually help with controlling our sebum production too as well on that side. But the things that we do want to emphasize is that dosing is extremely important, meaning that we start out with a microdosing and then working up, titrating up to find what is your therapeutic value or your optimal dose. Just like traditional medicine, where you have a doctor or a psychiatrist or a pharmacist there walking you through the titration process, you are your own advocate now, and you're watching your own dosing to make sure that you're achieving the values that you want to achieve.
Absolutely.
Yeah. But thank you so much, Sang,
Thank
for
you
being
for having
here.
me.
We love this conversation, so we greatly appreciate your time.
Thank you.
Yeah.